All right, it's 7 p.m. People, I think, are still going to start trickling in, but I want to be respectful of your time since you're here in the evening, especially. So we're going to go ahead and get started. This webinar will be recorded, and I'll be sending you a recording of it, hopefully tomorrow, but if not, definitely within the next 48 hours. Um, you can hear me, but you all should be muted. Um, there will be some points where I'm going to ask you some questions, and you're welcome to just pop into the chat and answer questions. And there will be time at the end of the webinar to ask any more questions that you need. But just so we're clear, this recording will be sent out. So don't feel like you really have to stress out about writing notes or anything because you will get a copy of this in a bit. My name is Andee. Some of you know me because some of you foster for us already or volunteer, which is awesome. So I founded the Kitten Alliance back in 2019. I had been working in rescue for about a decade beforehand. I have always had a special affinity for what I call the wonky kittens. I really love the young ones, the sick ones, the ones that a lot of other people shy away from. I just really love seeing the progress. I love putting in the work and making sure that those harder cases really have the chance that they need to thrive. This kitten here is named Toby, and he's just a few weeks old in this picture, but when he came to us, he had had his umbilical cord wrapped around one of his back feet for 4 days before he came to us, and that had cut off his circulation. And this picture was actually taken when we were sitting in the parking lot waiting for our vet. When we got Toby, it was during COVID, so all the vets were doing um, parking lot service. But he was getting a weekly laser therapy to try to help the inflammation in his leg. He did end up losing his leg, but I ended up adopting him. And he zooms all over the house. He has a couple cat brothers and he has a new dog brother, and he never misses a beat. And later in this presentation, you will see a updated picture of Toby too. Here at the Kitten Alliance, if you're not familiar with the organization, we do focus on rescuing newborn and medically fragile kittens. We have a good foster home program. We partner with organizations all across the region and even sometimes all across the country. And we do a big focus on community education. So classes like this and all sorts of other resources that we're able to give to communities and other shelters and rescues to make sure that they're best prepared for kitten season. So since being founded in 2019, we have saved thousands of kittens. We provided support to hundreds of different rescues and county shelters, and we've taught thousands of people to care for newborn kittens. Here's a snapshot of some of our programs. So we have the basic programs that all rescues usually have. So we have a foster program, a volunteer program, an adoption program. But we really have a focus on that rescue and shelter support, the community education, and then different programs to help the most vulnerable kittens. So we have an ICU to help kittens who are sick and injured. We take in a good amount of nursing moms, so we have a good maternity care program. And then we also have a pet food pantry that's got started during the hurricane fairly recently here in North Carolina. And it's still small, but we're working on building it. But we are able to help our community in that way when we're able to. Our nursery, which is located just outside Asheville, North Carolina, does serve as an ICU for the most vulnerable kittens. So we have incubators, oxygen concentrators, nebulizers. We're equipped to tube feed. We have multiple quarantine areas for different illnesses. And we pride ourselves on having a really highly skilled staff. Even though about 80% of the kittens that we rescue each year either come to us too young to be weaned yet or are very ill or injured when they arrive, we do have a save rate of about 85 to 89% every year, which is very impressive considering the demographic that we take in. And our facility also acts as a learning hub, and we do adoptions out here as well. So first, let's talk about where orphaned kittens come from. So if you were, in the lobby of a shelter and somebody came in with a couple newborn kittens who they found outside, think for a second about where these kittens may have come from. How did they end up alone? Why are there so many of them? Go ahead and answer in the chat if you have some ideas of where these kittens might be coming from and how they ended up potentially as orphans. While you're thinking about that, we will go on. So basically, most of the kittens that are found outdoors were born to community cats. So these are the cats, some people call them feral cats, but these are the kittens who might be around the places where you live, shop, work. A lot of these community cats aren't very social. They might be cats that if you approach them, they're going to run away, they're going to hide. Not always, but a good amount of these community cats haven't been well socialized. One of the problems is that these cats can get pregnant as young as 4 months old, and their gestation period is only 2 months. So they can have several litters of kittens a year. And each of those litters, on average, is going to have 4 to 5 kittens, but sometimes it can have, 6, 7, 8 kittens. A couple years ago, we even had a mom come to us with 10 kittens, which is really wild because she does not have that many nipples. So we had to actually take a few of her kittens away and put them with a bottle feeder because there was no way that she was going to be able to feed all of them. So these cats, if they're not spayed, can have several litters of kittens a year. And something really crazy is because the gestation period is only 2 months long, and kittens can get pregnant when they're 4 months old. It means that a kitten being born right now can have her own litter of kittens by the end of this season, which is just mind-blowing. So it's really important that these kittens are spayed and neutered, or these cats are spayed and neutered. Um, so uh, if your community has a trap neuter return program, and if you live here in Asheville, we're actually lucky to have several of them. We have Sister Kitten, Friends to Ferals. These are organizations that go out in the community, humanely trap these cats, get them spayed and neutered, and then, release them back to their outdoor homes, which these community cats are often more comfortable and feel more safe living in these outdoor homes. But they're not able to continue having these kittens. So when these trap neuter return programs do that, while the cat's under anesthesia, they actually clip off the tip of their ear. It happens under anesthesia, so it doesn't hurt them. But this is a really easy way for these trap neuter return teams and even the community to understand that when they see this cat, that this cat's already been fixed. So these are not cats generally like if the trap neuter return team was to trap them a month later and say this was like a basic tabby cat, a black cat, and they didn't really have a lot of distinguishing markings on them. If they trap this cat later, they're not going to be able to handle this cat to look for a spay incision, look for a spay neuter tattoo, whatever. What would happen is this cat would be transported all the way back to the clinic and they'd be put under anesthesia. And then as they were prepping the cat for surgery, the doctor would say, "Oh, this cat's already been fixed." And then this cat would, stay overnight at the clinic and then be brought all the way back. And it's just, it would be a real waste of resources. It would put a lot of extra stress on these cats. So it's really important that with this tip off their ear, the community can quickly just see that this cat's already been altered and can release them from the trap and then set the trap again to try to grab a cat who hasn't been altered yet. So that's why that tip is there and it's really important. Um, as well as understanding where these kittens come from, it's also really important to understand how to tell if these kittens are truly orphaned, because what we find every year is that we take in, a lot of kittens who it really seems are unnecessarily orphaned. These kittens do have a mom likely who is taking care of them, and somebody had really good intentions by taking these moms and or taking these kittens and bringing them to a shelter, but the problem is that these shelters are packed full, and we really need to save room for the kittens who truly need it. So placing, kittens who have a good mom taking care of them with a bottle feeder is not the best for the shelter. It's not the best for the kittens. It's not the best for the fosters. It's really not the best for anybody. So let's talk for a minute about how to tell whether kittens have been truly orphaned and what to do if it seems like mom is there. So, first, some signs that the kittens may need help is if the kittens are, cold or wet to the touch. If they're limp and lethargic, you pick them up and they just kind of like, become limp. They're visibly injured or ill. So, some of these pictures off to the side, very clear eye injury, eye infection, losing a bunch of hair because they possibly have ringworm, something like that. Um, they might have visible parasites like maggots, fly strike. If you don't know what fly strike is, it's when flies have been, flying around a kitten or some sort of animal who can't defend itself, and they land and they lay eggs um, on the kitten. And so basically, fly strike is what happens before the maggots hatch. But it can be really dangerous because, of course, if those maggots hatch, there's that kitten can be a lot of danger. Or bot flies. Bot flies burrow into a kitten. Usually we see them around the neck area, and they grow inside the kitten and can cause a lot of problems. The kittens might be very dirty or greasy. So kittens who aren't being groomed regularly by mom might be very dirty or greasy. If they're not eating regularly, they might be crying for food. They may be very skinny, but maybe sometimes very skinny, but their bellies are really bloated, which might mean they have internal parasites. Or they just simply might be in an imminently dangerous location. So maybe the kittens look well taken care of, but they're in an active construction site or they're on the side of the highway or something like that. That is a situation where, you can use your best judgment, and it might be a situation where even if mom is around, those kittens need to leave because they're imminently possibly going to die. Signs that kittens have a good mom. So basically, all of the kittens here are kittens who probably should not have been taken away from their mom. So these are kittens who are bright, warm, active, don't have any visible injuries or illnesses, don't have visible parasites except for maybe a few fleas. A lot of outdoor kittens, even if they're well taken care of, might have, a couple fleas here and there. Um, they're clean and well groomed. They're quiet and content because they've eaten pretty recently. Their bellies are nice and plump and squishy, and they're in a reasonably safe location. Um, if you do find these kittens outside, we're gonna, if depending on what you've observed, whether they look sickly, whether they look pretty healthy, that's gonna kind of determine what you do. But I know that it's really hard to leave kittens behind if you find them, if they look healthy. But it's really important to understand that kittens really do have the best chance of surviving when they stay with their mom. Even the best foster who has the most experience is not going to take as good of care of those kittens as mom does if she's a good mom taking care of them. It's also important to realize that there are a finite number of foster homes for these cats and kittens, and there are even fewer foster homes who are able and willing to bottle feed. So, cramming shelters with these animals sometimes means that shelters have to make horrible decisions, and these kittens might end up being euthanized simply because there's no foster to take them home. And you'll learn tonight about why they can't stay in a shelter overnight alone without a mom or somebody to take care of them. So, sometimes it really is a matter of life and death to simply leave these kittens where they are as long as it seems like they're getting the care that they need. So here's just a quick, checklist. If mom is there, if you see mom around and maybe she's just kind of like lurking, watching you, or her kittens are definitely well taken care of, then leave them where they are. If you must take the kittens for whatever reason, do your best to take the mom too. And we're going to teach you in this class how to take care of them. If there is proof that mom won't be returning, so the kittens are in really bad shape, if you saw mom get hit by a car, something like that, then go ahead and take the kittens, but do a good look around, make sure that no kittens have crawled away from the nest, make sure you're getting everybody, and we'll teach you how to take care of those too. And if you're not sure, then the best thing to do is to stay at a distance and watch for a few hours to see if mom comes back. You do want to be far enough away that mom doesn't feel intimidated coming back. You want to make sure that she feels safe. And if you can't wait around, a pro tip is to sprinkle some flour around the nest, and then you can go back later and see if her paw prints are there. All right, so before we get into what these kittens need, let's just make sure that we understand what neonate means so we're all on the same page about what we're talking about. So when I say neonate tonight, I'm going to be talking about kittens who are generally under 4 weeks old, not really old enough yet to be weaning. And neonate really applies to basically, any mammal who is under 4 weeks old. So, why do neonates need foster homes? There's a lot of reasons, and we're going to go through all of them. So, you know, basically the difference between when these kittens end up in shelters versus when they can go to foster homes is in shelters, most shelters are not staffed overnight. A lot of shelter staff is overworked, so it's really hard for them to drop what they're doing every couple hours and bottle feed a kitten. Um, Most shelter staff are not trained to safely and effectively bottle feed a kitten, so asking somebody who's not trained to do it to bottle feed a kitten might lead to aspiration or other problems with the kitten. And then also think of a shelter environment where there's just tons of animals coming in and out every day from unknown situations. That inevitably exposes kittens to possibly diseases, viruses, fungi like ringworm or something. Which are things that, if older cats are exposed to them who have, pretty strong immune systems, those might be things that an adult cat can kind of shake off, or if an adult cat is affected, maybe isn't going to be that big of a deal. But for these kittens that are very fragile, they have very delicate immune systems. Being exposed to a disease is so much harder for them than an adult because their immune systems are so vulnerable and they haven't had any vaccines and all this stuff. So, in a foster home, these kittens are getting 24/7 care. They've got a dedicated foster who's giving them one-on-one attention. They've been trained. They've been given the supplies that they need. And they're a lot less likely to be exposed to all these things that they could be exposed to in a shelter. So these foster homes are really important, especially for tiny, tiny kittens that we're talking about tonight. All right, pop into the chat. Let me know if we're talking about human babies and kitten babies. It actually turns out that these two need a lot of the same things. What do you think a baby kitten needs that a baby human might also need? What kinds of things do they both need in order to grow and be safe? And I do have some spring allergies going on that's making my throat scratchy, so I'm gonna suck on a cough drop while we're talking. All right, so I'm seeing they need love, food, warmth, shelter, feeding every few hours, cuddles. So basically, when it comes to kitten care and when it comes to human baby care as well, and probably the care of every animal, we basically are going to break it down into four sections. So they need warmth, they need nutrition, they need a clean environment, and they need medical care. So we're going to talk about all of these things in four different sections tonight. But first, let's talk for a second about how to know how old your kitten is, because knowing how old the kitten is can help you determine exactly what kind of care they need. So a kitten who's under a week old, generally their eyes are going to still be closed. They might still have their umbilical cord attached. Their eyes typically start to open between 7 and 10 days. The umbilical cord usually falls off around 5 days, 5 days old. Between 1 and 2 weeks, their eyes should be fully open. Their umbilical cord won't be there. They'll start to be a little bit more alert. Their eyes will be open, but they'll still be kind of seeing, and their vision will not be great. So they'll be able to see movement and light, but they're not going to be able to see anything super clearly. So they kind of sometimes have these like, alien eye expressions. Um, Between 2 and 3 weeks old, their eyes will be fully open, still not fully focused. But at this age, towards the end of this, around 3 weeks old, they're going to be um, starting to explore a little bit, but they're going to be really wobbly on their feet. 3 to 4 weeks old, you're going to start noticing their incisor teeth. So it's maybe these tiny little teeth at the front of their mouth are going to start coming in. They might start, kind of nibbling on your fingers. They're going to start exploring more. And at this time, they can start um, maybe trying to lick up some wet food, just testing it out. They might try exploring the litter box. They're not going to be good at either of those things yet, but they can start kind of, exploring a bit more. Between 4 and 5 weeks, kittens start getting really fun. They start playing a lot more. Um, they're still kind of wobbly, but they become more confident. If it's a litter of kittens, they'll start, tumbling around and playing a lot. Um, and they will start getting those teeth, those sharper teeth right on the sides of their mouths. And then between 5 and 6 week olds, they start getting the teeth in the back of their mouths. Those are the premolars. And those are the signs that the kitten's ready to start transitioning from nursing or the bottle to starting to eat more wet foods. So that's around the time they start to get fully weaned. And around this time, they should also be starting to really master the litter box. All right, so let's talk about warmth. So, what we're going to talk about here is why these kittens need external warmth, especially if they're orphans. So, if they're with their mom, she provides them with a lot of warmth. But, tonight we're really focusing on orphans. So, we're going to talk about why they need an external heat source, what kinds of tools you can use for that, what kinds of safety measures you should be thinking about, and what are kind of safe housing that you can use. So, kittens can't regulate their own body temperatures until they're a few weeks old. And that means that we need to use some sort of external warmth for them to make sure that they don't get too cold. Um, Getting too cold is dangerous and can actually be fatal for a kitten if they get too cold. So, you always want to focus first on warmth before you do anything. And that means you even want to get them warm before you feed them. So it can feel kind of instinctual with if you get a new kitten and you think that they haven't eaten in quite a while and maybe they're crying because they're hungry. It can feel like the most urgent thing to do is to feed that kitten. But the truth is that if you feed them before they're warm, the kitten can't actually digest that food, and that can actually cause a lot of problems. Um, and it can really be dangerous for that kitten. So the first thing you want to do always, before you feed, before you do anything else, is to make sure that kitten gets nice and warm. So before we send out, if we get a new kitten in, before we send them to foster, we make sure that kitten's nice and warm. So we pop them in an incubator, we put them with a heat source, make sure that they're nice and toasty before we do any sort of intake on them, before we feed them, and definitely before they go out to their foster home. Here's some tools you can use. The incubator up here is one of the cheaper ones that you can buy on Amazon. And this is something that might be good for somebody to have around who fosters on a pretty regular basis. This particular one is not an incubator that produces its own heat. So, it's probably not good for like preemies or anybody who really needs very, very consistent heat that's, pretty warmer than normal. But this is good. You can put a heating pad or heating disc, one of these heat sources in it, and it kind of creates a little chamber where it just kind of keeps things warmer than if all the heat was just kind of leaving quickly and going out into the universe. So it can kind of create like a little warm chamber. And these are also just good for kind of keeping kittens contained. They're pretty easy to clean. We have a few of these on hands to give to our fosters, and I do really like them. And then the heating disc down here is called a Snuggle Safe. That's the little pink disc at the bottom. These are really common to use for fosters because they're pretty inexpensive. You just put them in the microwave for a few minutes. They stay warm for hours. And then you can just basically, every time you go to feed a kitten, pull it out, warm it back up again, and make sure that you need to make sure that it stays warm. But these are really good for traveling, really good for having at home. You don't have to plug it in or anything. So we have a lot of those for our fosters too. The heating pad, we really like the Sunbeam version. If you use a heating pad, there's a couple things to know. A, you want it set on a low heat. You don't want it to be producing too much heat and getting too warm. But also, if you're choosing a heating pad, make sure you choose one that doesn't have the automatic shut off, because you don't want a situation where you think that a kitten's staying nice and warm, but the heating pad has shut off and you don't really notice, and then the kitten actually gets cold. So they have two versions, one that has an automatic shut off, one that doesn't. We use the one that doesn't have an automatic shut off. But the heating pads are nice because they're flexible enough that you can actually fold them in half and stick them on, just half of the crate that they're in or half of whatever housing you're using so they can have room to move on and off that heat source. And they're also really easy to clean. Um, Rice socks are something that we sometimes give to people who are in the community who find kittens and they're not looking to surrender them. They want to take care of them, but they just need help with supplies and stuff. Um, if you work with a shelter, these rice socks are really there's something good. They're a good project to give if you have, Girl Scouts that want to come volunteer with you or homeschool groups. These are really good projects to give to these groups who want to help the kittens. They can just make the rice socks and you can keep it. They're pretty easy to just store. And then hand warmers, I don't think that those would be great to use as like a long-term source of warmth just because they can get pretty expensive. But we always keep some of these around because they're really good in emergency situations. So um, our staff likes to keep them in their cars so that if we're, not here, but we get a call about a kitten, we have them in the car and can, quickly put them to use warming up a kitten if needed. They're really good if the power goes out and you don't have a way to plug in a heating pad or warm up a rice soccer heating disc in the microwave. They're really good to have on hand just in weird situations. Um, Fire safety measures. So again, you never want to feed a kitten who's cold. They won't be able to digest the formula. It can cause a lot of problems. But you also want to make sure that when you're using something like a heating pad, one of those snuggle discs, anything, you want to make sure that the kitten has access to the warmth, but can also move off of the warmth if they get too hot. So um, even a kitten who's just a couple days old will move on and off of the heat source as needed, as long as they are alert and active. Um, but you want to be really careful about not leaving a lethargic kitten unattended on a heat source because they can really quickly overheat. Genevieve is asking about what a kitten safe temperature range is. I don't think I have that written in this presentation, but I can, when I send you guys the video, let me make a note of that. When I send you guys the video, I can send you a chart that I have offline here. Let me write that down, and I will, when I send out the video tomorrow or the next day, Genevieve, I will include that in the email. Um, so a kitten who's too cold may feel cold to the touch, may be lethargic, have pale gums, and that is the more common thing. So a kitten can be too cold or too hot. Being too cold is more common. But here in the South, sometimes we do get a kitten who's been overheated. So like maybe a kitten who was found in a parking lot in the direct sun on a hot day or something. And signs that a kitten might be overheated, they may be panting, their gums may be really red, they may be warm to the touch. So always good to kind of make sure that your kitten is a good steady temperature. When it comes to housing, the good thing about these really young kittens is they actually don't need a lot of space in your home. So up until kittens are about 3 weeks old, they pretty much just sleep all day. So they can actually be really easily kept in just a simple carrier. We really like these ones here that are the open top carriers. It's really easy to just at feeding time open up that top and grab them instead of opening the front thing and having to kind of like dig around. That open top makes it really easy to grab the kittens out. And you can fit easily the heat disc in there. You can fit, a heating pad folded in half right in there. You can put pretty much everything you need in there. But once a kitten turns about 3 weeks old, remember that's the time where they start to get a lot more active. They're going to start playing more, exploring. And at that point, you're probably going to want to put them in some sort of bigger space because also, remember that's about the time they're going to start exploring a litter box more and they're just going to need, they might want to start like every now and then sniffing at some wet food and they're just going to need a little more space. So we like these pop-up playpens to give to our fosters, but you could also put them in a bathroom, in a laundry room, in a spare bedroom, maybe a small one, and just, keep them pretty much contained, but they can start having a little bit more room to roam around. And until they're about 4 weeks old, you still want to keep them with that external heat source. So you still want to make sure that they have access to a heating pad, the heat desk, whatever, to make sure that they don't get too cold. All right, so now that your kitten's nice and warm, then we can talk about feeding them. So we're going to talk about nutrition. We're going to talk about what to feed them, what kinds of supplies and tools you'll need, how to prepare the formula and how to store it, how to feed them safely, how often to feed them, how much to feed them. We're going to talk about weighing them to make sure that they are eating enough and growing with the rate that they should. And then we'll talk about some feeding challenges. Um, so there are a bunch of different options when it comes to feeding kittens, but the best case scenario is that you're feeding them some sort of formula that has been specifically designed to meet the nutritional needs of kittens. So you want to be feeding them a kitten-specific formula. Um, Down at the bottom, you'll see a couple options. So the one in the middle that says the Pet Ag KMR, that's the one that you're most likely to find at, PetSmart, Walmart, any place like that. The one on the end, though, that says foster care, that is the brand that we like to feed here at the Kitten Alliance. That is the brand that we've found is least likely to cause diarrhea. Um, the challenge is that you have to buy that online. You're not going to be able to walk into a store and buy that. So you do have to kind of plan ahead a little bit. Um, and then in a pinch, you can feed a kitten goat's milk. So if you find a kitten in the middle of the night, you aren't going to be able to access formula, or maybe you're, in a pretty rural community and you're going to have to order something online and you can't get it right away. Goat's milk is something that you can feed in a pinch. Interestingly, goats produce milk that the nutritional breakdown is actually very similar to that a cat produces. So goat's milk is a good option, but you never want to feed a kitten cow's milk. They're not going to be able to digest it well, and cow's milk is highly likely to cause diarrhea, which can lead to dehydration, malnutrition, all sorts of things that you don't want to deal with. So avoid the cow's milk, use goat's milk if you have to. Best case scenario is you have some sort of kitten specific formula. So the tools you'll need is you'll need that formula. You'll need either a bottle or a syringe, one of those, not the syringes that has a needle on it. You'll get the syringe that you could, if you needed, twist a needle onto the front, but we're not going to do that. But you'll get a syringe and then some sort of nipple. If you use the kits, you'll have a few choices of nipples in there, but if you are fostering on a regular basis, we actually suggest investing in what are called Miracle Nipples, the mini size. Kittens have a much easier time latching onto them for some reason. So those are what we use. If you do use the nipples that come in the kits, know that they do not come with holes pre-cut in them. You actually have to cut the holes in them. A couple times every year, there's people who, call us and say, I found this kitten and I've been trying to take care of it and it looks like he's eating, but he's always crying and I don't know why and he's losing weight. And we'll have them bring the kitten in so we can take a look, and we will find that they never cut a hole in the nipple. So the kitten has been, trying to eat, but is not getting anything, and therefore is losing weight, is crying because they're hungry. Um, and so you really have to be careful. And when you cut that hole, you want to make sure it's just the right size because if you cut it too big, then milk can rush out and too much can go into the kitten's mouth. It can actually go into their lungs and um, not be good. But if you cut the hole too small and the kitten might look like they're eating, but they're not actually able to get a whole lot out of the hole. So you want to do it really slow and just make sure that you're cutting a hole that's the size where when you tip the bottle upside down, you want the milk just to, slowly drip, 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 drip out of it. If you turn the bottle upside down and the milk just comes pouring out, that's too big. You're going to need to cut a new hole. But if you turn the bottle upside down and you really have to squeeze the bottle hard in order for anything to come out, then that kitten's going to have a really hard time sucking the bottle out of there. So, Pamela asked, does the Miracle Nipple have holes in them? Yes, the Miracle Nipples have pre-cut holes that are exactly the right size. So if you are able to invest in those, strongly suggest it. Um, and then we're going to talk in a few minutes about feeding challenges. And if you have a kitten who is not making a really strong latch or, um, isn't eating dependably, and you want to kind of like more closely measure how much they're eating, then feeding them from a syringe might be the way you want to go. And if you use an oral syringe that has the oral tip on it, you can just put that syringe in the side of the kitten's mouth and just slowly drip in the formula and let them lick it up. But these Luralox syringes, which is what's pictured here, the Miracle Nipples actually will fit on the end of them, so the kitten can actually still latch to the nipple, but just feeding them from a syringe can help them get a bit more suction power than they would have in the bottle. And sometimes for a kitten who just can't form a strong latch, that can just help them eat easier. So you might want to have some of those syringes on hand just in case, even if you do intend to bottle feed. We use a blender bottle to blend the formula. So you want to, whatever you're doing, you want to make sure that the formula is made up to be very smooth because even though the nipples have holes in them, the holes are very small. So if there's any sort of clump in the formula, it can get, it can clog up that hole. And again, it can look like the kitten's eating, but actually the kitten's not really getting anything because the hole is clogged up and they're just not getting anything out. So the blender bottle here, that's just the bottle that you would use to, blend up a protein shake or whatever. Has the little ball in it that blends everything up. Um, we really like those because they're really easy to use, they're really easy to wash, and you can mix up the formula in there and just tuck that into your fridge when you're done, and you can make up a whole day's worth of formula in there, and it's pretty easy to pour it from there into a bottle. And then the last thing is a cup of hot water. So just make up a cup of hot water like you'd be making tea. And you can, once that bottle has formula in it, you can just stick it right into the water and just, every few seconds take it out and test it on your wrist to until you get to the right temperature. But that will warm up your formula pretty quick. So when you make up your formula, you make it up to the instructions on the package, but most formula is mixed 1 part powder to 2 parts water. But maybe there's some brands out there that are different. So always read the package just to make sure. Um, the blender bottle will help get all the clumps out. When you're making up the formula, you can make enough to last 24 hours. So you don't have to, make formula fresh at every meal. So this cuts down on a lot of work that you have to do. But after the formula has been mixed, after 24 hours, you do want to dump out whatever you don't use because it can start breeding bacteria. So only make enough to last you 24 hours. Um, Once the formula has been mixed with water, you'll want to stick that in the refrigerator. Any dry powder can just be stored in a cool, dry place that doesn't have to be refrigerated. And then at each meal, you'll just take the blender bottle, pour whatever you need into the bottle, and you'll stick that bottle into that cup of hot water. And then every few seconds, you'll take it out and just drip a drip or two onto your wrist. And you just want the formula to be just warm enough that you just barely feel it. You don't want it to be scalding hot because remember, this is going to go down the kitten's throat. You don't want to burn them, and you don't want it to be cold because just as cold kittens can't digest formula very well, they also can't digest cold formula very well. So you want both the kitten and the formula to be warm. So um, test on your wrist. It should be just barely above the temperature of your skin, so you should just be able to feel the warmth on your wrist when you drip it there. All right, so this is the position that you'll feed a kitten. So you'll place the nipple in the kitten's mouth and you're gonna tilt it in an angle that pretty much, whoops, sorry, thought I could play that video again, maybe not. Um, you're going to tilt it at an angle that allows gravity to do its job. So you're gonna allow gravity to push that milk into the nipple so the kitten can drink it. You always want to feed the kitten belly down. So you're going to feed the kitten basically in the position that it would eat from mom. You never want to feed a kitten on their back because that makes it really easy for the milk to go into their lungs instead of the stomach, and that can cause them to aspirate. So you always want to feed them belly down. Um, if needed, you can gently use your thumb and pointer finger and middle finger to gently brace the kitten's head. That can help kind of keep the kitten steady. Sometimes when you're trying to get them to latch, kittens are just like, bah, and they, flail a little bit. So getting a little bit of a brace on the kitten's head until they get that latch can be really helpful. And then if the kitten refuses to latch or if they're screaming a lot, at that point you may want to switch to a syringe just because you have a bit more control over it. And you really want to be careful not to be sticking formula in a kitten's mouth while they're screaming because that means that they're everything down into their lungs just kind of like a wide open. So that can make it easy for them to aspirate. So you want to in that case, having the syringe can just give you a bit more control over what's going into their mouth at any moment. All right, so something really great is that fairly recently, I don't know if it was last year or the year before, but there was a study done at UC Davis where they actually found out that these newborn kittens don't necessarily have to be fed every 2 hours around the clock, which is what shelters have been thinking needed to happen for my whole career. So, more than a decade. But, that thinking that the kittens need to be fed every 2 hours has always made it really hard to find foster homes for these kittens, really hard to you know, it made it just so complicated to care for these kittens. But what the shelter program found at UC Davis was that as long as the kittens are healthy, they can actually be fed less frequently than we previously thought. So what they found was after a few initial feedings, we were going to just kind of, get established with the kittens. You're going to get to know them. After that, even the youngest kittens should be able to have their feeding spaced out a bit more. You'll still need to feed kittens who are weak, ill, underweight. You still want to keep up with more frequent feedings for them, but these healthy kittens, you should be able to space them out a bit more. And then they also found that waking, sleeping kittens actually can hurt them more than it helps them because these kittens actually need uninterrupted sleep in order to grow in the way that they should be. So this chart here is, what we normally would say was the frequency in which kittens needed to be fed, but now it's a bit more flexible. So a kitten who's under a week old generally is going to be fed every 2 hours. And then, how it used to be was every week that kitten grew, you would gain an hour of sleep. Basically, now what we do is start the kittens off as something similar to this schedule, but for the first few feedings, you're really going to start paying attention to when the kittens start waking up and start moving around and rooting for the food. And you're going to be paying attention to if they're crying when they're hungry or if they're just a little more active. And you're going to start learning that these kittens are going to tell you when they're hungry. So each kitten's going to be different. Some kittens will want to be fed every 2 hours, but we have found that, especially overnight, these kittens can go for quite a bit longer, 4 or 5, even 6 hours sometimes, depending on the age of the kitten. But a lot of fosters now don't have to feed a kitten every 2 hours around the clock, no matter what. There is a lot more leeway there. So that has made it a lot easier to bring in new fosters, which is so critical because there's so many kittens who need help, and it helps the fosters, um, manage having, lives, and it helps them really take better care of these kittens because they're getting a little bit more rest. So, um, that is some really exciting news that helps a lot of people become fosters. And if you wanted to read more about that study, you can find it at sheltermedicine.com. All right, so weighing kittens is really important because we want to make sure that kittens are gaining basically every day. And it can, with a kitten who only weighs 200 grams, it's nearly impossible to look at them and know whether they've gained or lost. So you really want to be weighing them on a consistent basis, because weight can be one of the first indicators to let us know whether a kitten is doing great or not. So um, we recommend that any kittens who are under a week old, new to your care, or who are medically challenged in some way, should be weighed several times a day. And that can really just mean you weigh them in the morning and then you weigh them at night before you go to sleep. Um, Older, stable, and kittens who are familiar with you and that you already know a history of them being stable can be weighed just once a day. You want to weigh them at roughly the same time each day, basically because you want to create a situation that is apples to apples, not apples to oranges. So, if you weigh a kitten, some roughly between, 8 and 9, 8 and 10 in the morning, every day, then you can kind of see what that kitten is like at a specific time every day. But if you weigh a kitten on Monday at 8 in the morning, and on Tuesday you weigh them at 5 in the afternoon, and then on Wednesday you weigh them at, noon. Like you're just not really getting like you're just not really getting the full picture there. It's kind of hard to make comparisons. So, we recommend just choosing a time of day, staying within like a, 2 hour time frame, just to get that weight. Um, and then definitely weigh with a scale that weighs in grams rather than ounces. So pretty much any kitchen scale is going to be able to weigh in grams. We really like this scale at the top that has the bowl on it, because you will find that the kittens will try to climb out of it, and they get, it can get hard to kind of keep them contained. But even this flat scale, you can put any sort of bowl on top of it and just hit that tare button to make sure that it zeroes out the weight of the scale so that you're only weighing what the kittens weigh. Um, these kitchen scales are pretty cheap to buy, and they last forever. So when I send out the video, I'm also going to send you a copy of the weight chart that we use, which is on, I think it's on the next slide. And so you'll get a copy of that so you can use it if you need to. But this is the chart that we use. This is the chart basically that our fosters take home with them. So you'll see that there's a column for the date, there's a column for the time of day, there's a weight column, there's a column where we can quickly see whether the kitten has gained or lost, and then there's a column for notes. So um, you'll see that in the first few days, we were weighing this kitten 2 or 3 times a day. Once they started stabilizing, we cut back to weighing them once a day. Um, and then you'll see, so in the notes, the first day that kitten came in, we started them on antibiotics. They had a respiratory infection. Later that day, they had some loose poop. That's not really uncommon when antibiotics are started. That is, a pretty common reaction to antibiotics. Um, by the next day, about 24 hours later, their poop had gotten solid. But by the next day, their latch started getting kind of weak. So we switched to a syringe so we could really monitor how much that kitten was eating. And then by the following day, their latch had gotten stronger. You can see that they started gaining weight again. So we went back to bottle feeding. These charts are really important, whether keep the chart that we're going to send you, whether you keep a journal, whether you have some sort of app or spreadsheet, whatever you do. They're good. If you're fostering for an organization, it's really helpful for the staff of the organization to be able to say, well, I see that they've lost some weight. Like, when did the weight loss start? Like, you being able to just quickly reference a chart and instead of having to think back, like, oh, I think maybe it started on Tuesday, but maybe it was Monday. Just being able to quickly um, look at this is so helpful. And it really helps everybody who is involved in saving these kittens understand exactly what's happening. Um, it's also good if you had to, go to the vet with your kitten or, go to the emergency vet or something. It's really great to be able to just bring this chart. The vet can quickly look at it and see, what kind of medications the kitten has been on, what has their poop look like, all this stuff that can help just give any caretaker quick information that will help them determine a care plan, help them determine how the kitten's doing. And you just really shouldn't be keeping that all in your head because there's just no reason for it. So we're going to give you this chart when I send out your video of this webinar. We'll give you a chart you can download if you want to use it. Um, and then when it comes to feeding challenges, the two things that you might want to learn down the road is syringe feeding and tube feeding. We're not really going to get too deeply into either of those in this webinar because tube feeding is something that really should be taught in person. I will note that if you are local or somewhat local to us in Nashville, we are always happy to teach you to tube feed. So feel free to email us at info@kittenalliance.org if you want to learn that. If you are not near us and you want to learn it, usually there might be somebody at your local rescue who knows how to do it. You might have a vet nearby who can teach you how to do it, but it's really something that should be learned in person because it can be really dangerous. But it is critical to get nutrition and calories into kittens. So if they're having a hard time eating from the bottle, you're going to have to kind of adjust your plan. So syringe feeding basically is what you would go to if the kittens, if you just want to more closely monitor exactly how much they're eating, if they're having a hard time latching onto the bottle because they can't get like a really strong latch, or if they're not latching to something, but they are physically swallowing. Because what you're doing with a syringe is you are either putting it in the front of their mouth, the same that you would do with a bottle. But because the syringe has a little more pressure in it, it can give them just a little bit more suction power. So that sometimes can just allow them to get that latch that they're not able to get on the bottle. Um, but if they are swallowing, but they're not really latching, then what you're going to want to do is put that nipple or the tip of the oral syringe into the side of their mouth and just slowly drip it onto their tongue. And you're going to allow them to just lap it up and swallow it. If a kitten is very premature and they don't have a suckle reflex yet, sometimes that doesn't come. That suckle reflex is like one of the last things to develop before a kitten is born. So if they're very premature, they might not have that suckle reflex yet. If they have a really bad respiratory infection that's making it hard for them to breathe while they're latched, then it's going to be really hard to get nutrition into them. Or if for some reason they can't or won't swallow. So, you're dripping formula onto their tongue and they're not lapping up and swallowing it. They're just kind of letting it sit there and dripping out of their mouths. Those are situations where you're going to have to move on to tube feeding. And so obviously in that case, you're going to find somebody who knows how to do that if that's not a skill that you have yet. Um, my personal opinion is that anybody who is caring for newborn kittens should at some point learn how to tube feed. Um, it is one of the best life-saving skills you can have. So, again, I'm going to say that if you do live anywhere near us, we're in Asheville, North Carolina. If you're anywhere near us, we're more than happy to teach you how to tube feed. And you can just get in touch with us at info@kittenalliance.org if you want to take me up on that. All right, let's talk about cleanliness. So we're going to talk about why keeping kittens clean is very important, why and how to potty them, when to consider bathing them, how to do laundry safely, and sanitizing the environment. So cleanliness obviously is very important because these neonates are very, very delicate. So we want to minimize them being exposed to viruses, bacteria, urine scalding. Obviously a kitten who has pooped and the poop hasn't been cleaned up it can breed bacteria. A kitten who, is fed and has milk on their face and it's not wiped up, that can also breed bacteria. And then a kitten who pees on themselves, that can actually cause urine scalding because the pee is so acidic. So you want to keep these kittens nice and clean. Keeping them clean is one of the best ways to keep them healthy. So when it comes to kittens who are very young, you actually do have to help them use the bathroom. When they're with their mom, she grooms them basically all day, and she actually eats their poop and pee. The good news is you don't have to lick them, but what you do have to do is at every meal, you'll take a tissue, a clean cloth, a wet wipe, and you're just gonna gently stimulate the kitten's genitals. The kitten should pee at every meal and that pee should be either clear or really light yellow. So if you're seeing pee that's very dark, if it smells strongly, if it's tinted with pink, any of these things can be a sign that maybe either the kitten is dehydrated or they have some sort of urinary tract infection, something like that. Um, and then on average, kittens are going to poop about once a day. So all kittens are on their own schedule. And, some kittens only poop naturally every 2 days. Some of them poop 3 times a day. But on average, it's about once a day. And healthy kitten poop was going to be about the consistency of toothpaste. And it should be brown or maybe like a brownish yellow. Sometimes the formula makes it like a brownish orange. But if you see poop that is, bright yellow or, tinged with blood, if it's black, if it's gray, anything like that can indicate that the kitten either has maybe like a bacterial infection or is not digesting their food well, or, has parasites, anything like that. So the poop can be a really good indicator of health status. So you want to keep an eye on that. It is notable that when a kitten is transitioning from mama's milk to formula, sometimes they don't poop for a few days. And as long as the kitten's belly remains nice and soft and they're not straining but not producing anything, then that's totally fine. So you only really have to worry if the kitten's belly becomes really hard, like they're just very obviously constipated and not making anything. Then you want to be concerned about that. But it's totally normal for kittens not to poop for a few days if they've been eaten from mom and then suddenly they're transitioning to formula. All right, so when it comes to bathing, generally speaking, most people, you don't have to bathe most kittens. They pretty much keep themselves clean, especially once they get a little bit older and start grooming themselves. But, as long as you're keeping up with helping them potty, normally you're not really going to have to bathe them. Now, there are some exceptions. So sometimes they do poop on themselves, sometimes they pee on themselves, sometimes they come to us covered in a lot of fleas and we need to, get them off more effectively than if we were combing them off. And then sometimes they come in covered in something really toxic like motor oil. A couple years ago, we had kittens who had accidentally been doused in gasoline, like stuff like that. You need to like get off there pretty quickly. If you do have to bathe your kitten, you're going to want to use warm water, not hot. You don't want to scald them, but you want to remember that these kittens, if they get cold, it's dangerous. So you want to, make sure that their body temperature stays up. So that means bathing them in warm water. You want to be careful not to get water in their ears, nose, eyes, or mouth. You want to do it as quickly as possible. And then you're going to dry them off with a towel or even a washcloth if they're very small. And then you're going to blow dry them until they're completely dry. And you're going to want to make sure to hold that hair dryer a little bit away from them so you're not like directly putting very hot heat on them, but you're just going to kind of from a distance blow dry them safely, completely dry. And then you're going to return them to the cozy nest. You're going to return them to the their housing where they already have some sort of heat source. They're going to have cozy blankets and keep them warm as much as you can through the process and make sure that they have a nice warm place to go back to because you don't want them to get cold. All right, when it comes to laundry, you just want to basically, every time you're feeding the kitten, go ahead and check the bedding. If they have peed on the bedding, if they've pooped on the bedding, if they've, puked up milk on the bedding, go ahead and take it out, replace it with clean bedding. And then any dirty bedding should be washed with bleach. That is the best way to kill bacteria, parasites, viruses, anything else that that kitten might be exposed to that you might not even know they've been exposed to yet. Always wash any bedding that has come in contact with kittens in bleach just to make sure everything's good to go. And then when you're sanitizing your home environment, we definitely stress with our fosters that wearing gloves or a dedicated set of clothing, especially with kittens who are sick, is really smart. You don't want to be, passing something along to your owned animals or anything like that. If you don't want to wear gloves, definitely wash your hands thoroughly before and after handling the kittens. Um, you can regularly clean their housing using soap and hot water. You can use a sanitizer like Rescue, which is a concentrated peroxide solution or a diluted bleach. Again, replace that soiled bedding immediately, and again, wash the bedding with bleach. All right, I'm just gonna try to speed this along. It's 8 o'clock already, so we're gonna try to zip through this last part, but we're almost done. So medical care. We're gonna talk about routine medical care, we're gonna talk about quarantine, and we're gonna talk about emergencies. So the routine medical care that we give at the Kitten Alliance is fairly standard across other shelters, but different shelters might have different policies around what they offer and at what time frames. But we start deworming our kittens when they're about 2 weeks old. They get 4 rounds of dewormer. Um, we start vaccinating them when they're about 4 weeks old, or when they weigh a pound, and we do 4 rounds of vaccines. We microchip kittens when they're about 4 weeks old. We test them for FIV and FELV when they're around 8 weeks old. And we get them spayed and neutered when they're around 2 months old. They have to be 2.2 pounds to get spayed and neutered through the clinic that we go through. And then if the kittens are still in our care when they're 4 months old, they get their rabies vaccine. We do always suggest that fosters quarantine kittens for the first 2 weeks, especially if they're new to the shelter and the shelter doesn't know necessarily what they've been exposed to. Kittens can carry parasites, diseases, and other illnesses for up to 2 weeks without showing any symptoms at all. And so these are diseases that could be spread to your own animals, and some diseases like ringworm, which is not a disease, it's a fungi, but like ringworm, and some things can actually be spread to dogs. They can be spread to humans. So you want to be really careful about making sure that you're keeping a safe environment. Um, you want to keep these kittens in dedicated housing away from your resident animals for at least that 2 weeks until you're pretty sure that they are safe. And then we do recommend being mindful in your handling. Don't hold these kittens against your clothes and then hold your owned animals against your clothes. Consider wearing gloves and washing your hands. Consider changing your clothes before handling other animals. All right, the most common challenges that we see with these kittens is eye infections, respiratory infections, um, kittens who are underweight, They might have diarrhea, constipation, be dehydrated, and have fleas or other parasites, whether internal or external. A lot of these challenges can be related, but they don't always have to be. But like, kittens who have upper respiratory infections also often have eye infections. Kittens who have internal parasites often have diarrhea. Kittens who have parasites might also be underweight. Some of these things can be related, but they can also stand on their own. But if you're going to be fostering, just know that these are things that are very likely that you're going to have to deal with at some point. And so these are all things that you would work with the rescue that you're fostering for or with your veterinarian to make sure that these kittens get the care that they need. This is a list of what we consider to be emergencies here at the Kitten Alliance. So when people foster for us, they get sent home with this list, and we have a 24-hour emergency line that our fosters can contact us at. So basically, if they see any of these signs, then that warrants a call to us, and either we will take a look at the kitten at our facility, or we will send them to one of the 24-hour emergency vets in our area. But basically, if the kitten's severely lethargic, if they have labored breathing, if they have severe diarrhea, if they vomited more than 2 times, if, they jumped off of a cat tree and suddenly their leg is swelling up, something like that, injury to an eyeball. These are all things that we want to know about right away. And even if the shelter that you're fostering for doesn't have this list, this is a pretty standard list where I would say any animal you're fostering, if they show these symptoms, you know, that warrants some sort of emergency action. And then with male kittens, if they're, going in and out of the litter box and not producing urine, that might mean that they have a blockage. So that's something to pay attention to as well. Finally, let's talk about fading kitten syndrome. So, fading kitten syndrome is an umbrella term that basically just is an umbrella term that encompasses a few basic symptoms. So, your kitten might be lethargic, be losing weight rapidly, be cold to the touch, have really pale gums and glassy eyes, maybe gasping when they're breathing. This is what we call fading kitten syndrome. The potential causes for this, this can come on very suddenly. And often it's either because the kitten has become hypothermic, which means that they're too cold. They've become hypoglycemic, which means their blood sugar has dropped. They might have some sort of internal infection, so maybe they've become septic, and you didn't even know that they were sick, or you did know they were sick, and just the antibiotics they're on aren't working fast enough or something. Or they might have some sort of birth defect. So remember that a lot of these kittens that we're taking in are coming from these outdoor colonies, and so, a lot of these kittens are often, the result of inbreeding, which can result in a lot of birth defects. And sometimes, you can see those birth defects externally. So you might notice that maybe the kitten has a cleft palate, a cleft lip, a twisted legs, like things like that can be the result of birth defects. But there's also a lot of birth defects that happen internally that we don't even know are problems until the kitten starts crashing. So basically, the things that we can fix is we can fix if they're too cold, and we can try to fix if their blood sugar has dropped. If it's an infection, by the time that they've started crashing, it might be too late to save them. Although if you get them to the emergency vet, they might be able to give them, IV antibiotics, and you might be able to turn them around. And if it's a birth defect, that is something that is really hard to save a kitten if they're crashing as the result of like one of their organs shutting down or something. But the action plan for a fading kitten is essentially get them warm quickly, and then put sugar on their gums, and then you're patient. So basically, you wrap them up in what we call a burrito. So you wrap them up in a nice soft blanket, just keeping their little face exposed so they can breathe, but you want to get them nice and warm. You can even take a heating pad, put it on low, and wrap it around the blanket so you're getting them nice and warm. And then you'll take some sort of sugar. It's it's easy if you use like corn syrup, like a Karo corn syrup, and you can just dip a cotton swab in it and just roll it onto the kitten's gums so that there's sugar going into the kitten's body. And you'll do that basically every 3 minutes. Go ahead and set a timer, and that helps kind of get the kitten's metabolism up. And then you'll just want to, sometimes the kitten can snap out of it in, 10 minutes, and then sometimes it takes a while longer. So you just want to be patient and just try to get the kitten nice and warm and try to get their sugar up if possible. And then if you have the resources, this would be a good time to go to emergency vet as well. Um, so Pamela is asking why the males are more prone to get blockages. It's just because of the way that their urethra works. They're just more likely to get bacteria up into their penis and more likely to have blockages there. So, female kittens, uh, it's not uncommon for them to, get urinary tract infections, but they're not common to, it's not impossible, but they're not common to get a blockage. But males are more prone to get urinary blockages. And then Pamela also asked how we can tell if a kitten is hypo. So if you're talking about hypothermia, the kitten is going to start feeling cold to the touch. So like their paws might feel cold, their nose might feel cold, their ears might feel cold. Um, if they're hypoglycemic, you might notice that their gums are pale. They've kind of become a bit lethargic because they're just kind of starting to feel really weak, things like that. All right. And then unfortunately, because these kittens are so fragile, the national average is that around 40% of orphan unweaned kittens do pass away in shelters or foster homes within the first few weeks of life, and that's despite really good care. And that's because of all the stuff we've talked about. So neonates are very fragile. We rarely know what they might have been exposed to before coming to the shelter or before you found them. We don't often know the medical history of the mom or who the mom even is. Um, we don't, if their kittens truly have been abandoned, we sometimes don't know why mom abandoned them. So sometimes mom abandons kittens because she can tell that something is wrong with them. And we might not be able to tell something is wrong with them yet, but they might have something wrong with them, one of those internal birth defects, and mom knows, and we just don't know yet. Um, and remember, these kittens often are the result of inbreeding because in these colonies, sometimes these cats don't travel far to breed. So that makes them more prone to genetic abnormalities. But what I always like to remind people is even though that's really hard to think about, and, it's hard to think about if you start fostering neonates on a regular basis, you eventually probably are going to deal with one of them passing away. It's really important to remember that without foster homes stepping up to take care of these kittens, 100% of them would die because these are kittens who absolutely will not survive without a foster parent taking care of them. These are kittens who cannot eat on their own. They can't keep themselves safe. They can't keep themselves warm. So 60% of these kittens nationally do survive because people have stepped up to make sure that they are safe. Um, so I do hope that that helps you feel more confident in taking on something that might be emotionally challenging. But because it's also emotionally challenging, I do want to take a minute to talk about compassion fatigue. If you remember at the beginning of the this presentation, I showed you my friend Toby who had lost his leg. This is him now as an adult. He's adorable. Um, but compassion fatigue is basically the physical, emotional, and psychological impact of helping the victims of trauma. And kittens who've been abandoned, kittens who've, been injured, abused, these are victims of trauma, right? So if you are helping these kittens and you're seeing every day how fragile they are, that can have a big impact on you, especially if you're, working really hard to keep them alive. They're so fragile. This can cause mood swings, insomnia. Maybe you're getting headaches, feeling anxiety, having digestive issues. Um, these are all, excuse me, these are all symptoms to really pay attention to, and something to make sure that you're taken care of before it gets out of hand. So we definitely suggest being in touch with your body and your feelings, taking breaks. So, if we always encourage our fosters, like if you're feeling burnt out, if you're feeling like you really need a break, and we ask you to take another kitten, please tell us no. Like take a step back, take a couple weeks, take a month, take a break, go visit friends, go, whatever. Just never feel like you have to say yes. Take those breaks if you need them. That helps us in the long run save more kittens. So get comfortable with saying no. And then I always suggest making a physical list of things that you can do to recharge. So writing something down and having it handy, I feel like it really helps in a situation where, if you're feeling burnt out, you're not going to want to think about, oh, what can I do to help me feel better? Like, just have a list handy so you don't have to think about it at all when you're feeling burnt out. You just have it there. So, on my list, I like to go for walks. I like to go for hikes with my goofy dog Theo. That's him in the picture. I like to read books on my porch. I like to cook dinner and experiment with new ingredients. I like to watch movies. Take a minute in the comments and let me know if you had a 3 hour break in between feeding kittens. What are some things that you could do to recharge that would make you feel better, make you help you breathe a little bit? Let me know what you think that you could do to recharge and feel better about yourself if you were feeling exhausted. Um, okay, I'm seeing croquet, time in the garden, awesome. Go for walks. Yeah, getting outside is a really good idea. Care for houseplants. Yeah. Take a nap. Good one. Yep. I'm not good at naps, but I wish I was. Watch movies. Yeah. Yeah, so I suggest, if you're gonna take care of kittens, write these things down. So just so you can, easily access them. You don't have to think about it when you're feeling burnt out. You can just say, oh, I like reading books on my porch. Maybe this is a good time to go spend an hour reading a book on my porch. Um, and then if you've gone through this presentation and you've said, oh wow, like neonates, probably not for me. They take a lot of work. That doesn't work with my schedule. No problem. There are a lot of other animals at every shelter who need foster homes. So, off the top of our heads, there's 4 categories of animals that we have both here at the Kitten Alliance and in shelters all over the country who really need help. So, there's always nursing moms. And these are great because you do get to see those tiny babies, but you're not the one having to feed them. So mom does all the work, but you still get to, you know, have tiny kittens in your house. There's the sick or injured kittens who may need some time just recovering from an illness or recovering from a surgery. They do much better in foster homes where they can receive one-on-one care. There's kittens who are, healthy, but they're just weaning. They need somebody to help teach them how to eat wet food and help, figure out how to use a litter box. Um, or there's kittens who are almost old enough to get spayed and neutered, but, still have like a week or two, and staying out of the shelter helps them stay healthy so that they don't miss that appointment because they get sick. And then there's also shy or under socialized kittens who just need a quiet, chill home so that they can, understand that humans can be safe. A lot of these, sometimes kittens have never really been exposed to a human who's friendly and kind and just need somebody to teach them how to trust. Other than newborn kittens, under socialized kittens are my personal weakness because it's so awesome just to like put in a little bit of work every day and watch them really come out of their shells is so cool. So these are all animals who definitely could use your love and help if neonates are just not in the cards for you. All right, it is 8:18, and we are done. I am happy to answer more questions. If you guys have questions I didn't get to, feel free to put them in the chat. I'll stick around for a few minutes. And I just want to note that if you go to our website, kittenalliance.org, there's a resources tab, and under there you can find all kinds of resources. We have a blog that covers a lot of stuff. We have some downloadable resources. But I'm also, when I send out the recording of this webinar, I'm going to send you the temperature ranges of a healthy kitten, and then I'm going to also send you the weight chart if there's any other resource that you would like me to send to you, I can attach that on if you have any questions. Is asking, what exactly is tube feeding? So, tube feeding is a special kind of way that you feed kittens who are unable to swallow, are for some reason bottle feeding them or syringe feeding them is either not possible or not safe. But basically, how tube feeding works is you take um, a little tube that's flexible and it has like a rounded tip on it, and you put it down the kitten's throat into their stomach, and then you attach a syringe to it, and that's how you get food into the kitten's stomach. Um, Syringe or tube feeding is something that I definitely believe that anybody who is regularly taking care of kittens should learn, because when a kitten needs it, it is really one of the best life-saving tools that you can know how to do. But the reason we don't teach it, via webinar like this, and we only teach it in person, is because it does um, it does require that the person very confidently knows how to put that tube in correctly and make sure that it's going in at the right length so that um, it's safe. Because if you're putting the tube accidentally into the kitten's lungs instead of into the stomach, that can kill a kitten. So the reason you always want to learn in person is because you want that hands-on experience. You want to be able to ask questions. You want to make sure that you are learning in a way that makes you feel confident and that you are 100% sure that you are doing it safely. So that is something that I do think people should learn, but definitely need to learn in the correct way. Emily is asking, does the weight feeding chart include the milliliters recommended per feed? Our feeding chart does not include that, but I can send you another chart that does. So when I send out this video, I will send a chart that gives you the milliliters recommended, depending on the kitten's weight. Uh, all right. Does anybody else have questions or anything else that they would like me to include in the email that I send you in a few days? Okay, we are going to go ahead and close out this webinar. Thank you so much for being here and for being open to learning about kittens. Whether or not you decide to foster, I personally think that the more people that have this information, the better, because we just are better, well-rounded communities for the kittens, because you can pass this off to your neighbor who finds kittens or a friend. So the more people who know, the better. If you have questions that you think of later, always feel free to email me. You can email me just at info@kittenalliance.org, or you can go through our website and you'll find our information on there. But thank you all so much. I hope you have a great night, and I will be in touch within the next day or two to send you more information. Thank you.